Just a short little video about how to self-inject. Now before I get started, I want to say that this is not an educational video, so if you want to learn techniques on how to inject yourself, go and ask someone qualified, go and ask a nurse. This is more a video about if you are in a situation where you have to self-inject yourself regularly. It's more about becoming comfortable with doing it yourself, having the confidence to inject yourself daily. Okay, so I'm injecting myself with Tinzaparin sodium, so it's a small injection. It's a small injection. But having said that, any injection is no fun, especially if, like me, you are actually a needle phobe. So I don't like needles, I don't like having my blood taken, I tend to faint. So actually injecting myself is actually quite a big deal, and it feels very unnatural to inject yourself. You know, it's one thing injecting someone else, but actually injecting yourself feels really unnatural, and it's almost like you have a resistance to doing it, and you need to get over that. But having said that, there are advantages to injecting yourself. If you inject yourself, you will probably take a lot more care than someone who's just injecting you, you know. For example, on my arm, I don't know how well you can see it, but I still have bruises, and this bruise is 2 weeks old. I mean, that is old. Imagine what it looked like 2 weeks ago. And that's from multiple of these injections, done almost in the same site, and it's still lumpy. There's still a hard lump in that area. And that's just because, you know, some nurses come, they just give you an injection, they inject it really quick, it's painful, it hurts, and it gives you bruises that take ages and ages and ages to go away, and it's not pleasant. Also, if someone comes and just injects you, you know, probably they have loads and loads of other people to inject as well, so they honestly don't care if you're ready, and they just literally jab you. Whereas if you're injecting yourself, you do it within your own time, and you make sure that you're ready for it. Okay, so before you get started, you should have been given some kind of a sharp spin in which to put the needle in after you're done. So I'm giving myself this little injection, and I give it in my belly. You can give this kind of subcut injection in your arm, in your belly, or on your thigh, and for me, I just find the belly is easiest. Having said that, you know, this is not an educational video, so make sure that the kind of injections that you give yourself are, that you do them in the right way. This is literally only for a Tinzaparin injection. So anyway, what can I say? You just have to do it. You know, whatever you've been taught, however your nurse has taught you how to do it, you're just going to have to do it. You know, if you're injecting yourself, then obviously you've been taught how to do it, and it's safe for you to do it. It should be safe, at least. That's why they've given you, you know, your box of injections and sent you on your way. So at a certain point, you just have to get on with it. Okay, that's what can sometimes happen. Oops, and I don't have a tissue, but having said that, that's probably about the worst that can happen when you inject yourself. Sometimes, I don't know, you hit a little something and it bleeds, or perhaps you haven't gone in quick enough and a bit of blood comes out. Now don't forget, after this, you need to dispose of your needle in your sharps bin. Okay, which sometimes can be quite difficult to open. Okay, let me wipe myself up. Okay, so I'm back, and I've wiped off that little spot that was bleeding. It's fine. It's fine. You know, it's just a little something, and literally that is about the worst that can happen when you actually inject yourself. So you're going to take your needle, and don't forget to dispose of your needle, yeah? So you get your sharps bin and you just literally pop it inside all the way through along with the rest, close it, and that's it. You're done for the day. So anyway, like I said before, this is a video about having the courage to self-inject yourself if you've been taught how to self-inject yourself. So this is not a video where you just go and randomly grab some kind of injection and start injecting yourself. No. So once you've been given instructions, you've been taught, but you lack the courage to just go ahead and do what you've been taught on yourself. You know, this is more to show that you can do it. And having said that, remember, I am actually a needle phobic myself. So